At the heart of Palliative Care Southeast are people. People diagnosed with a life-limiting illness who want to make the most of their time that they have left. The people that love and care for them, and our staff and volunteers who support them on that journey. From humble beginnings in 1984, Palliative Care Southeast has grown into an essential service for our community, one that continues to support individuals at the most vulnerable times in their lives.
Your angels from heaven.
Most nurses nurse people both back to health. Palliative care nurses nurse them to the end, and they're a different bunch of people. They're just brilliant. I don't have enough praise for palliative care.
Today, we have a purpose-built facility in Narre Warren where 60 staff are employed to provide clients, their families and carers with specialist palliative care support and services. Our dedicated staff and volunteers work tirelessly to provide responsive, holistic, in-home palliative care so our clients can focus on living well and their quality of life. During the COVID-19 pandemic, demand for our services increased by almost 50% as more people chose to receive care at home. So our role is really about improving the quality of life for individuals so that every minute counts. So if you're faced with a life-limiting illness, what's important to you is important to us. And so our role is to make sure that we support individuals to live their very best life and enjoy the life that they have.
She said, I'm not here to help you die. I'm actually here to help you live the best life that you possibly can. And that to me was that was a turning point.
When I first heard that they wanted to put me in palliative care, I went, oh, that's just end of life, but it actually isn't. That it's helping you enjoy life till the end of life.
When these people come around you, I forget my sickness actually, and I feel good. And I just start singing and enjoying the day.
By being a volunteer, I'm giving respite to the family. One Muslim family, the husband would go to the mosque for 2 hours while I stayed with his wife. He was very appreciative of the fact that he was able to go and leave his wife in safe hands.
My dad was diagnosed with lung cancer in 1988. When he was diagnosed, palliative care stepped in. They came every day. Of course, the pain got worse, so he needed more morphine and looking after. But they looked after him for those 6 weeks. And I've never forgotten that. And of course, now myself, I'm in the same situation.
I think often our clients have had a really long journey before they get to us. So there's been a lot of appointments and sitting in doctor's offices and scans and tests. And often they themselves can get a bit lost in the process. It's very medical and it's very focused on their disease and not so much them as a person. And then I guess once we become involved, we really take a big holistic look at them as people and what's important to them and what they value most. And I think that's quite comforting to them to feel like they're in control again and their decisions matter and we're listening to what's important to them.
I think you people understand, and it's more personal. And look, even though my doctor and some of the doctors that I have seen, well, they explain it, but they don't realise exactly how you feel and what you can actually do. Because at first, it's such a big shock when they tell you, and you know it's a death sentence, you know that.
Matthew one Saturday went to work and we got a phone call that he'd admitted himself to Monash at Clayton. He was only 22 years old. I cried because I was like, palliative care, does that mean that's it? He's gone. Now I didn't realise that there's all the services that it leads up to it and prepares you and prepares the family, prepares the patient. He was gone in 3 months, so it was very quick.
We were actually trying for 10 years to have a child. And yeah, we had a miracle. But then 6 weeks after is when Katie found out she had the cancer. Basically, they helped us in the time where we needed it. They were there whenever we needed them. And even afterwards, when Katie passed, they done these great bears up. That's the toughest time, because Katie managed to fight the cancer for 8 months and then lost the fight. But she got to be a mum and to a beautiful little boy.
I think it's very much a privilege in that it's something that we can be involved and help people at a very difficult time in their lives and help improve what can be the hardest time in a youth's life. And it's very much an honour to be able to do that. If I can do it well for one person and one family, then it's worth doing.
With around 75% of Australians needing palliative care before they die, PCSE is now an essential service. As our population ages, the demand for palliative care will only grow. Today, in addition to our clinical and allied healthcare, we offer life-enhancing programs like art and music therapy, a biography program that assists clients to document their life stories, virtual reality that enables armchair travel, and our memorabilia program.
We're available 24/7 over the phone, so it's just knowing that there is somebody out there that can assist you, whether it is just phone advice or physically coming to somebody's home to see them. I think people value knowing that there is a support out there that can help them.
When we needed a nurse, she was only a phone call away, but she just seemed to always arrive just at the time you needed her. Like, you know, and they were very, very helpful. Nothing, you couldn't ask for anything better.
So I think what we do is we really empower people and we give them back that kind of control again, and they feel like their voices are being heard.
For me, I don't think I chose palliative care. I think palliative care chose me about 30 years ago, yeah? So being a nurse and having that opportunity to work with people who have a life-limiting illness and who are coming towards the end of their life just gave me a lot of satisfaction that I could just be there for them and work with them with whatever their needs are. In palliative care, you always had the opportunity to spend a bit more time with people, you know, to work with them and their families with symptom management, or just sitting there and holding somebody's hand while they're dying if they had no one else around them.
It was like angels walking in the door. Honestly, it was a relief that I could speak to someone that knew exactly what I was going through. I could not, honestly, have done it without them. I wouldn't have survived.
Personally, it's a bit of a relief because I know that there's always somebody's going to be there. And that takes a lot off your mind. Somebody's going to be there, keep an eye on you. I've got family, but it's just, there's a professional there looking after me. That's what it means.
Thank you.
Today, let's commit to working together to give everyone the chance to live their best life, access professional end-of-life care, and die with dignity in their place of choice.